An area often overlooked in cancer treatment is nutrition. Although physicians can provide dietary guidelines, it's difficult to gauge whether patients actually adhere to them. Our goal is to facilitate communication between the patient and their nutritionist or physician, both in and outside of the hospital environment. One example of intended users would be patients with leukemia or lymphoma, or patients who have weakened immune systems due to chemotherapy. These patients require a neutropenic diet, which helps protect them from harmful bacteria in some foods. The key differentiating factor of our product versus other products is that we leverage the power of IBM Watson to provide image recognition and text-to-speech. The ease of use is further amplified by the integration of our app into social media, which allows us to tap into the pre-existing patient behavior of sending food photos and provide a source of data for their dietitian. The low cost of entry into our web app and the universality of mobile phones helps us close the healthcare disparity gap. Our revenue model is a subscription service for clinics and hospitals. We can help institutions provide value-based healthcare by providing a supplement to in-house checkups with real-time monitoring of patient diet, reducing the readmittance rate due to dietary complications. As a potential secondary revenue stream, we could ask insurance companies to provide a revenue stream that would keep patients eating well and avoid future medical expenses. Currently, we've developed our app to work on 2 platforms. We have a version that works on an Android, which allows you to simply take a photo, send that photo off to Watson and categorizes it, and then returns the caloric information of that photo. We also have a live version that anyone can try by simply sending this hashtag, Health Hackathon Food, on their Twitter account, and a demonstration. So currently,
cheeseburger.
Currently, we're able to identify the food using Watson's image recognition service, take that food and put it into the USDA's food composition database, and return the caloric information of that food. We also have warnings if the food does not comply with a neutropenic diet, and we warn you if the food is above a certain fat or sugar threshold. In fact, anyone in the audience, including the judges, who should have been sent a link to this versus by text message, should be able to send a Twitter with the hashtag Health Hackathon Food and have it appear on screen right now.
30 seconds.
Thank you.
Sorry.
What do you think the compliance will be of monitoring someone's diet on a day-to-day basis? Do you think there'll be obstacles there, and how will you overcome them?
At the end of the day, we're always relying on the patient's honesty in their treatment, and honestly, you have to rely on the patient to take their treatment into their own hands. Our hope is that by tying this into social media and by making it a continuous monitoring service rather than monitoring simply through clinical checkups, or by requiring the nutritionist or dietitian to constantly send messages and emails to the patient, that this simply provides a smoother, more seamless method for them to communicate with one another. There's also the aspect of social and peer pressure from that social media aspect. And, people are just interested in what's in their food.
Regarding the integration with IBM Watson, how does that integrate with your revenue model in terms of the cost of that service for your business?
So it's true that Bluemix, which is the platform we're developing this on, is a premium service in the sense that if you get a large enough user base, you will have to start paying for services. However, their pricing model is usually based on per use. As long as we have a subscription that has enough patients to cover that per use cost. And of course, we can work out pricing even by institution. Larger institutions would have a larger subscription than small institutions, but it's definitely affordable. Even the text-to-speech you saw there, that's only 2 cents per 1,000 characters, and the first 1,000,000 characters are free.
Thank you.